Hello and welcome to Recovery Weekly, an interactive weekly program used to guide you, the family member of an individual with a substance abuse problem, through the process of recovery. I'm your host, Scott Kaling, joined as always by my co-host, Ian Koch. Ian is a licensed drug and alcohol counselor, as well as an internationally certified addiction specialist. Thanks for joining me today, Ian.
Thank you. Good morning.
Morning. Today on the show we have Melissa Westerman. Melissa is a customer relations coordinator at WestBridge Community Services and is responsible for developing and monitoring relationships with individuals, families, and referral services, as well as marketing duties. Prior to this, Melissa was a care manager for WestBridge from 2003 to 2005 and was responsible for providing direct clinical services to participants and families who experience co-occurring mental illnesses and substance use disorders. She has worked in the mental health substance use field since 1996. Thanks for joining us today, Melissa.
Thank you for having me. Good to be here.
No problem. Now, WestBridge is geared towards helping treat individuals with dual disorders, specifically mental illness and substance use issues. How does a co-occurring mental illness present itself alongside substance abuse?
Well, from what we've seen, we have the participants that we see have obviously symptoms of addiction and substance abuse. But aside from that, they're also presenting with symptoms of mental illness. So, and most, if not all, have already been diagnosed with a dual diagnosis of a severe mental illness along with an addiction. So they're presenting with symptoms of both illnesses.
Okay, so they know specifically this is the place they need to be to get the proper treatment they need instead of going to a rehab and maybe not having those services.
Well, usually, I mean, we get all types of people with different treatment histories. We certainly get people who found us early in their illnesses and who have found us and found that we're the right treatment center to treat dual diagnosis. There are also a lot of people who have been to several very traditional addiction treatment centers who either weren't able to adequately address their mental illness, or there was, for whatever reason, traditional addiction treatment didn't work well for them. So we've gotten a mix of everything, and most of our participants have been in several treatment stays. The founders of WestBridge have a loved one who has a schizophrenia and a substance abuse problem, and what was happening with him was that he would go to traditional addiction treatment centers, and they would do an excellent job of helping him get clean and sober and hook up with the 12-step community, but they weren't really sure how to treat his schizophrenia. He would then go home and stay clean and sober for a little while, ultimately relapse, or stop taking his medication, end up in a psychiatric hospital, and then the psychiatric unit would say, well, we can adequately treat his schizophrenia, but he's got to go get clean and sober first. So for about a decade, he was in and out of treatment. So to directly answer your question, there are some people who don't know what they need and don't know how to find it, or end up in places that cannot adequately address both illnesses.
And the big controversial, I don't even know if controversial issue is that if there's co-occurring disorders, mental illness, and substance abuse, everyone goes back and forth. Well, get them sober first. No, treat the mental illness first.
Right.
And that in itself is not really necessary. I mean, and I think that's where WestBridge really excels, is they're able to really work on both at the same time. A lot of these places down in Florida, these big treatment centers, they do really good at treating addiction, but that's what they treat, or that's what they try to treat, I should say. There's still the mental illness, even if it's just depression or anxiety that runs rapid. And then, I mean, we can't deny the fact that addiction treatment overall across the country has, 50% relapse rate when people leave. And a lot of it is because of these, underlying issues that the person's sober, they're abstinent for 30 days, but they're just almost, just as worse as when they went in internally. The symptoms have kind of shifted and changed and, look and manifest differently. and then they leave, and they're, it's like showing up at a knife fight with a pen. It doesn't work.
Unless it's a pen knife. No,
Yeah. Unless it's a pen knife.
Now, Melissa, Ian actually brought up a great point. He mentioned anxiety and depression. Now, if it wasn't to the extent of being clinical depression or clinical anxiety, would that still constitute a dual diagnosis, or does that kind of come with the territory when treating substance abuse?
Probably not. Probably not. I mean, dual diagnosis, as we define it, is a severe and persistent mental illness. So that is clinical major depression. That's bipolar disorder, schizophrenia, some personality disorders. So sometimes the folks that certainly have some mild depression and mild anxiety that seems to be a result of their addiction might not fall into that category. That's certainly up to a psychiatrist to sort of determine the severity of their symptoms. But the folks that we see and the folks that have been studied in the research and the evidence-based practices are molded around are the folks that have a severe and persistent mental illness that would exist most likely regardless of an addiction.
Okay. And now you say that you treat them both at the same time. How is that accomplished exactly?
Well, we use integrated dual disorder treatment, which is called IDDT, and that can be looked up on the Dartmouth Psychiatric Research Center website. They're the ones who developed it up at Dartmouth in Lebanon, New Hampshire. And what that means is that we're treating both illnesses at the same time. So there's a lot of things, there's many, many components that go into that. But what we do is we have psychiatrists on staff, we have a multidisciplinary team of licensed clinical social workers, licensed alcohol and drug counselors, vocational specialists. So that multidisciplinary team all comes together, and we make sure that people are exposed to, traditional addiction methods, motivational interviewing, stages of change, 12-step, along with treating their mental illness so that they're getting psychiatry, they're getting psychiatric nurse care, medication management, obviously counseling and therapy. And there's all these components that go into it, of course, but the point is that we're doing it all at the same time. We don't really care about the chicken or the egg argument, which is often where families come to us and say, well, I don't know, I mean, he's been this way since he was a teenager. Do you think, he started using because he's always been an anxious kid? Or do you think, he was born, with this predisposition to substance abuse and then, the mental health stuff came after that? Like, we're not as concerned with that. I'm not saying it's not a valuable argument, but we're less concerned with that because we're going to treat them at the same time. Like, it doesn't matter to us which came first. It's certainly valuable information, and as we assess and evaluate people, it's important. But in terms of treatment and the treatment protocol, treat them at the same time, treat them long term.
I see. And now, how much of a factor do the families play in of the person that has a dual diagnosis? Do you provide a service that educates them on what's going on?
Absolutely. Yes, huge. Absolutely huge. And the research supports it that family psychoeducation is part of good outcomes, and success is linked to family involvement. And we use a model called Family Education and Support, FES, that was modified from behavioral family therapy, again, an evidence-based practice that was developed by Dartmouth Psychiatric Research Center. And it is a long-term family program, so it's not just a weekend, or it's not just a couple of sessions during their stay. It's a mandatory part of the program, so families have to sign on to it. And it's weekly sessions. So if they're not a family that's geographically close by, we'll do conference calls. And they are required to do weekly conference calls for the duration of the participant's stay.
All right. And do you feel that there are any unorthodox methods of treatment at WestBridge that you wouldn't see at any other facility?
Well, in most part, we use evidence-based practices. So
Good.
those unorthodox in themselves. I mean, that's the core of what we do. There's a few programs that we're ramping up with right now. For example, sleep hygiene. We're working on a sleep hygiene program. Obviously, we all know how important sleep is, and we've sort of taken a look at how undervalued it can be in treatment. And so what we're doing is we're hiring sleep coaches, we're doing sleep assessments, we're really getting in there and understanding how well people are sleeping and trying to remedy any sleep issues. We just, it's, kind of a no-brainer, but we feel that has got to be a huge component of treatment. So that's just one of the programs that, that we're working on right now.
But even you guys, the ACT services,
Mm-hmm.
ACT community services,
Mm-hmm.
even that's somewhat unorthodox to most treatment. I mean, there's programs out there doing it. I was a part of a program about 4 or 5 years ago called Pathways to Housing, which was a housing first model out of Philly that is in Washington, D.C. and Burlington, Vermont, where it's mainly for the homeless, get them in housing, and then provide services. But the ACT services, there's not a lot of programs doing it because it's fairly expensive to do, but it's so effective. And for those who don't know what ACT services are, and Melissa, if you guys do things slightly different, please chime in, that really you go and provide the services to the person in their environment. And it's many people, so it's not the traditional, oh, I've got to go see my therapist, walk down the street, go to the therapist appointment, but that the therapist at times will go and meet the person in their home and do things like that.
Mm-hmm.
And some people say, not necessarily for WestBridge or certain programs, but I know folks who've done in-home therapy and they were criticized for it. That's not safe, that's not ethical, but the truth is that a lot of very effective work between the counselor and client can be done in the client's own setting, in their natural environment. They don't have all the boundaries built, and it's not as intense and rigid. It's much more comfortable, and it becomes a human talking to a human versus, somebody in authority talking to somebody with, less authority. So.
Right, absolutely. Well, and I think people need to appreciate that, WestBridge isn't for everybody, and there's all sorts of different types of treatment that work well for people. We just know, and, the research supports that assertive community treatment, the ACT teams, find great success. And yeah, you got to be careful. Certainly, people who are trained in social work, this is a very touchy sort of ethical boundary issue. You've got people in your car, you're in their apartments all the time, but you have to understand that our folks haven't responded to a traditional treatment. Yes. They leave residential treatment and they go home and they're expected to be at an IOP at 8 a.m. Guess what? They don't show up. They didn't know how to set their alarm, or they didn't hear their alarm go off, or they've got sleep issues, or they're on heavy medication and can't get up. They can't show up for appointments. That's the whole point. That's the service where, for the people who fall through the cracks, that get kicked out of programs because they didn't show up. Well, they're not, in most cases, not showing up because they don't want to be there. Like, they don't have the organization to show up. So, ACT's great. It's been around for a long time, and it sadly is not widespread. It's mostly in community mental health centers. It's federally or state funded, and isn't a private service because it's an expensive program to build and to run, like you said. But absolutely effective, and it's long term. We have some people who've been in our ACT program for 10 years. There's no cap on length of stay. And you work with people where they're at. They don't show up to an appointment, well, we may go knock on your door and see if you're okay.
It's actually very proactive and helpful. And I saw on the website, WestBridge's website, in the How We Measure Success section, there's an array of stats on there, like 45% of patients are attending school, and that 88% of individuals are living in independent housing. It seems like you really like to integrate the treatment with a normal lifestyle in place as well. And how is that made possible?
Well, it's kind of the whole point is that there's a lot of fantastic residential treatment centers um, that do such a phenomenal job. The majority of them are short term. And so my point is that trying to develop long-term solutions and long-term care means helping people live in their world and in their community. So our intention, even though people are in residential treatment, is to go into the community and go to 12-step meetings. They're not all in-house. They're going out to the gym in the community. They're doing, they're running errands. They're going for activities. They're going on hikes. Like, they're doing a lot of stuff in the community. And once people are in residential for a little while, we start hooking them up with volunteer, with school, and then once they transition to the ACT team, getting their own apartments. And I mean, that's the whole point, is life skills. I mean, certainly the therapy is important, and getting people a nice foundation in recovery, getting their mental illness stabilized. But from a biopsychosocial perspective, all of those other things like meaningful activity, social relationships, stable apartment, stable housing, all of those things are critical. I mean, nothing else can happen without that. So our whole goal the entire time is to make sure that people are accessing their resources in the community. They're going to school, they're getting their own places, they're making friends outside of WestBridge. They're it's critical for for long-term success, and that's where the rubber meets the road is the long term. What are people going to do? What are their solutions months down the road, years down the road? I mean, it's not over after 3 months.
And that's where programs, you also now, it seems like there's a big boom in extended care programs, and very supportive sober living, like the Grant House, Skip Murphy's Foundation House. These programs scattered about New England and they're not just in New England, but they're so effective because they keep people for a long term. While they're required to work. Everything Melissa just said. And I mean, my training as a therapist, and I'll be the first to admit that 1 hour a week is not enough. I mean, it's 1 hour a week is good for someone who's got it together and maybe has some issues that they need to move forward in life. But for someone who's early in recovery, or someone who's got a mental illness that's just kicking their butt, it's once a week is not enough. And there is this, I hear it sometimes in AA meetings and from clients and things. Well, I went to my therapist and I never stayed sober. Well, yeah, once a week isn't enough. It wasn't until I got to AA and 12-step recovery where I got sober. Well, yeah, the difference was you were going to a therapist once a week. Then all of a sudden, you started going to 12-step recovery maybe 5-6 times a week. You had, a sponsor and these other people that you're talking to on a daily basis. So it's kind of like the supports, the more supports people can get, the more effective the treatment's going to be. And I think some of these extended care programs are fantastic because they're taking people, some are taking people out of detox. Most want 30-day sobriety, but they get in and they're able to really extend, like they're called extended care, extend the amount of stay.
Right. Well, I don't want to open up a can of worms, but the sad reality is that insurance won't cover more than the bare bones.
Yeah.
So I mean, that's the problem with the system right now, is that people aren't getting adequate care, not because it's not available or not not there, but people can't. The majority of people can't afford private care. A lot of the private facilities are doing what works and doing what they know will work and will help people, and sadly insurance won't pay for that, and those are the people who fall through the cracks.
I talked to a guy the other day. He had Pennsylvania Medicare, which will only cover 5 days of treatment.
Right. Yeah.
5 days. So he ended up talking to a guy, and this guy used to own a program down, or not own, but run a program down in near Philly. And the guy said, listen, he said, if you show up on that property intoxicated, they're going to have to keep you. He said, you need to go out, you need to drink, go drink at least a 6-pack and show up with your bagpacks, and they won't be able legally to let you leave. And that's the way this guy got into treatment. He called places for 3 days straight. Nobody had any availability. So then he had to go out and drink to get into treatment. I mean, I've sent people up to Vermont who have no money, because if you live in Vermont for 1 day, you qualify for Vermont health insurance if you're homeless. So you can go up into Vermont and, get help up there. The system really is a mess, quite honest.
And we have to go and find a way, or like a loophole every time we have a problem. I want to thank you for joining us today, Melissa. And now, how can individuals interested in dual diagnosis get in touch with your company?
You can certainly go on our website, westbridge.org. We also have an 800 number, 800-889-7871. And we're on the phones almost 24 hours a day. So certainly can call directly as well. But certainly encourage people to check out the website. And thank you guys very much. I'm a big fan of Northeast Addiction Consultants, and Ian's doing great work, and just sort of talking about the family component. It's very critical and very needed, and Ian's filling that gap right now. So thank you guys.
No problem.
Thank you.
If you need help getting your loved one on the path to recovery, please call 1-800-723-1073 for a free consultation, or visit northeastaddictionconsultants.com. And until then, we here at Northeast Addiction Consultants wish you and your loved ones a safe journey to recovery.